specialist, and they will introduce anyone else that they bring up. So please, let's welcome them. Take the floor.
Is this the clicker?
Yes.
Sorry. Good afternoon. Yeah, it is afternoon. Good afternoon, everybody. My name is Yolanda Prince, and I am the program project manager.
You know what you are.
Oh, go ahead, keep going. I'm the project manager for the Texas Convention Center at Smith County. Our main office is on the campus of Prairie View A&M University. So I will let, thank you, Lana, so much for introducing us, but I'll let Miss Rebecca Ramirez-Barnes start us off.
Thank you so much, Yolanda. All right, as you know, she introduced us. We're all from Prairie View A&M University, but underneath that umbrella, we have the Texas Juvenile Crime Prevention Center, where I'm centered out of as a training specialist. Our director, Dr. Penn, is present here today as well.
Good afternoon, everyone. Glad to see you. Hope to meet you all.
We are currently under the College of Juvenile Justice, where we also have a dean and a provost. But what we mostly do is we're out in the community. We're trying to bring the university and other programs and services that we might have access to different communities throughout the state of Texas with the goal of reducing juvenile delinquency. It's a very big job, but we're working on a little bit at a time. We also have a collaborative other group that is now also at PV, which is the Wellness in Houston, as you can see there. Now, I know it says Wellness in Houston, but they are now branching out beyond just Houston, and Ms. Smith will be able to explain the counties that they serve. But pretty much we like to be in all over Texas, but again, there's a lot of work to be done. We also have a research department. So all I'm going to do is I'm just going to explain a little bit about what we do, what our mission and goal is, what is our strategic plan going forward. We've got major responsibilities. We have a new president, and she really wants to see PV move forward and be just more effective in change and just really overall improving society, as well as offering opportunities for education for young people and anyone else who wants to get more education. So just a quick overview of that. And well, it's not turning. Am I doing something right? It won't, it's clicking, but it's not turning the slide. Oh, yeah. See. Sorry, everyone. As always, there's technical difficulties. Isn't it nice?
I'm gonna try and
It's somehow it's not clicking through. So like it's blinking, but it's not. See, like it blinks. It's responding, but it's not turning it. I knew it wasn't me. See? There we go. Thank you. Saving the day. Thank you, ma'am. Okay, back to it. So our mission statement, dedicated to reducing juvenile delinquency and crime in Texas. That is our biggest goal. We want to be able to step in, and what you've heard of the school to prison pipeline. That is a real thing that concerns us. So if we can step in and do some work on the front end, we can hope that we can change the outcome. And so we want to also strive to improve advances in education, research, and service through the center and college. Our main focus is service. Yes, we are at a university, but we have quite a bit of faculty that can cover the education portion. But we also believe in providing service back to the citizens of Texas. Our areas are research on juvenile crime and delinquency, provided educational programs and training. For example, I'll travel around. Joclyn and I travel around. We'll do trainings on youth mental health first aid, on substance use disorder, the effects of heroin on the adolescent brain, what drives juvenile behavior, and the decisions that they make in an impulsive situation that ends up where they're arrested. So that's just an example of what we do. We serve as a state and national information resource. Our goal is that as we get more education, we can become the source for, if you all have questions about juveniles and the possibilities of them getting into criminal activity, you can come to us and we can, as experts, tell you what are the areas of concern, what do we need to focus on. We develop strategies to address juvenile crime. That includes like working with other, say, professionals that have evidence-based practices, programming or training or education, so that we can offer this out to the citizens of Texas for free. That's a beautiful thing because some agencies want to do the work but lack the funding. And then we create partnerships and collaborative initiatives. And like that, like I mentioned, Wellness in Houston is one of our collaborations. We also have a partner with the Salvation Army Red Shield program. We're also working on our partnership with Annie E. Casey Foundation. So these are things that we're always trying to work on, and who knows who else we can work with, because I know Dr. Penn is always out there talking to everyone he can to try to build these collaborations so that we can increase our ability to reach more people. And we want to deepen the understanding of human behavior and reduce juvenile delinquency and crime statewide. This is what you all do. You're trying to help these young people not get caught up back into the system that maybe someone else was involved. It's okay. So our objectives. Sorry, I probably stepped out of the window. Sorry. So our objectives are research and development. So this is where we have research scientists. We have 2 of them. And so they're going to help to increase the knowledge through research and evaluation, expanding the understanding of effective programs and policies. These are the individuals that could study somebody else's program and tell them, hey, what's working and what isn't? What can we do to improve it? How can we do better for these people? So we have a whole department working on that. We're hoping to expand, obviously. Now, education and training. As I mentioned, we're a university, so we want to strengthen our students' knowledge and skills in psychology and justice studies. We offer undergraduate, graduate, and continuing education, which is something maybe you all are interested in. And we also provide high-quality professional training. That again circles back to the training that I offer. We still have plenty of undergraduate, graduate, and PhD programs that if you are looking for more education in different topics, we have that for you. But if you're looking for something where my coworker and I come out, we just present on a topic, like I mentioned, substance use disorder with juveniles, like vaping. That's a really popular thing right now. We try to offer dissemination of information. We want to be able to offer the appropriate info that is up to date and knowledgeable and informative to you so that you can do your job better, or so that you're aware of some things that maybe young people are going through and it can help you interact with them. And we have partnerships, like I mentioned. We provide technical assistance and collaboration. We support agencies and communities through their partnerships. And then, like I mentioned, we've got Wellness in Houston. So with that, I'm going to defer to my colleague, Joclyn Smith, who is with Wellness in Houston, and she'll explain to you a little bit about what they do. And the slide's just going to stay the same.
Hey, so my name is Joclyn. I am an extension agent with Prairie View A&M University. I am considered an extension, so I work with the extension program in Prairie View. So our college has extension agents that go out in different communities, different counties, and we are all based basically in different areas. So there is someone out here in my actual department of extensions, and he's working as well. So the reason why I'm different than he is because I'm with Wellness in Houston. So Prairie View decided that they wanted a program based out of certain colleges. I'm out of the College of Juvenile Justice. The other gentleman that I was mentioning, he is not. He's just an extension agent of Prairie View A&M University, and he's basically, we have 56 counties that extension agents are in. Wellness in Houston only has 6 counties out of those 56. So I'm really Houston and surrounding areas. However, once I collaborate with him, Yolanda, and the Texas Juvenile Crime Prevention Center, I am able to go to those other counties as well. So that's the good thing about what I do. Based on the fact that our goal right now is really simple. So we just want to help families that are in Houston and the surrounding areas and wherever else we may be able to go. We want to have them live a little happier, a little healthier lives, benefiting off of the resources and the services that we provide. Like she said, we want to get out there because guess what? That's free to you guys, right? So if it's free to you all, we're going to try to touch as many people as we can. So that's why it's important that we collaborate with different organizations so that we can get out there and help support the healthy lives, the happier lives, the self-care and everything that we do. Me personally, I am a emotional and social wellness person. So that's mostly what I come out and do. I do work with Rebecca regarding the mental health first aid, which is something that I got through the College of Juvenile Justice, which is where we're all located, and the Texas Juvenile Crime Prevention Center. I personally can go out and teach many different things. I also have information about that on the table and more. When she was speaking about the school to prison pipeline system, I also go out and speak about that. I have a whole presentation on that. Things like that, the zero tolerance in Texas through the school district is very important, that they understand that zero tolerance means that there is no longer you do this and then this. It's like you do this, you're going here. So that's what kids are not understanding right now. And it's important that I get out and talk about that. But as far as what we're able to do for you all, if you have a need in your community, I am able to come out and get that need done. We have 5 colleges in Wellston, Houston. So mine is based on emotional and social, mental health and everything, correct? The other 5 colleges we have that are with Wellness in Houston is College of Business, College of Agriculture, College of Applied Health, and College of Nursing. So those different colleges do different things in the community based on what Prairie View has allowed us to do. We're all with Prairie View A&M University. We are all in different colleges, however. So I'm not going to do something that College of Nursing does. That's not my background. So when I come out, I'm going to do something based on juvenile justice, just a community outreach that helps juveniles mostly. But I do professional training with parents and educators. That's mostly what we do as Wellness in Houston. Whatever the need is, we're going to get out and do that. So it's based on what you all need.
All right, thank you.
All right, thank you.
So as you can see, wellness is very broad and offers quite a bit. So we mentioned these other schools because let's say you're going to get your imaginative ideas going that, hey, I'd like to see some group come out and teach the kids or the parents about nutrition. We have groups that do that. So those are just what we're trying to do. We're trying to really do a multi-pronged approach to helping families and youth. All right, so there's that. Do you have any questions about what I've explained? Any questions maybe from our research division, from the wellness division, for Dr. Penn, myself? Anything that you'd like to know, something you're curious about? I've answered all of your questions.
A few things.
Oh, okay, good.
Thank you all for the important work you do. Just have the floor for a minute.
Mhm.
CASA work. Thank you for what you do to foster youth that need you every single day. Now, if you look at the statistics, it will tell you that juvenile crime is down about 75% since that of 2000. That's great, but what does that mean for that family that's going through difficulty right now? What does it mean for the youth and those parents that are having difficult times? What Prairie View A&M University has done is created this Texas Juvenile Crime Prevention Center. I should better say that the Texas legislature produced the Texas Juvenile Crime Prevention Center. So this is a statewide mandate that is to work on reducing juvenile crime. Now you may say, okay, my CASA kids are in the foster care system, but we know how often those systems are parallel. But one day one can be in this system and the other. It is sad that we haven't cracked the code on keeping those systems separate. But we know that there's a need for services in both systems. So at Prairie View A&M University, under the Texas Juvenile Crime Prevention Center, we are here to do this job statewide. Our lead person here is Ms. Prince. Ms. Prince leads the office here in Tyler. Where are you located? Where's the building you're located?
I'm in the beautiful Cotton Belt building.
3rd floor has a wonderful suite and a cotton
Cotton
Belt.
Belt building.
Cotton Belt.
305, I'm in the penthouse.
All right, folks, writing it down. She's in the class right here. That's my A student right there. And say it one more time for the address and everything. Say it one more time.
1517 West Front Street. Suite 305, really 305 to 315, but the front door is at 305, and I have some cards I can give y'all too. And just call me before you come. Yes.
Do you handle Wood County as well?
Go ahead.
Wood County.
Wood County.
Right now, I'm just in Smith. We are, let me stand up. Right
Come on over here in front of the.
Yeah, right now we are in Smith County, but we're expanding across the state. I'm assigned 4 different regions, but again, we're looking to, and if you're interested, please contact me.
Okay.
So I can maybe, because that's a hop, skip, and that's not far. From here. Wood County is like a adjoining county.
Yes.
Was I on that road coming from,
No.
Houston?
No.
No.
Yes, but that's a good question. But mainly what I do as the project manager for the center, as we call it, is I am the one that provide the deliverables. I make sure the projects that we have, be it a study or a program, we're on schedule. I go out in the community and network with great people like Lana, which I met through another colleague, and she introduced us. And then also I host events like today we're having, and hopefully y'all can come. I know it's last minute, but today we're having the advisory council meeting because we're restarting that advisory council for the center. And the main goal is to get ideas from the community and express their needs. Now we do the what was passed out or the surveys, or survey that we had in the past, and more information on the table and about that particular study. You can get that information. And again, you can contact me if you have any more questions. But we need community members like yourselves to be a part of this advisory council, because each center each community has a different need. We also have centers in Houston and then another in Dallas. But, again, our main goal is to reduce juvenile delinquency and the crime in Texas. So this would be a good help. And again, I thank y'all for coming and wanting to know what we do as a center. But we'll be more than happy to help. And then also, if we can't provide that resource to you, then I can, find somebody that can. And another thing I want to add to that is we also have community forums. Like last night, we had a presentation of a past study, providing that information for the results to the community. So we don't want to get the data and hold it, because that's not the purpose. The purpose is to provide it to you all, and so that we can come up with solutions for this particular community. But I'm sorry, that was a long answer for you.
I wanna know how much time do you have today?
You have about another hour.
Oh, let's go, baby. Let's go,
Yeah, we want questions. We really want this.
I got it. This is what I want to do here. I really want to hear from you. Can we have somebody be our scribe over there and take down the notes here? Thank you so much. We really want to hear from the community. Last night, we heard from the community from the research that we did. Dr. Mandes is one of our researchers, and she worked on research that was done, 4 years ago?
I looked ahead and analyzed the data that was collected about 3 years ago by a former research assistant that used to be at the center, yes.
And Ms. Prince can have that available for you. And it asks the question of what's needed in the community to reduce juvenile delinquency. So we've got some good responses here. But I just love it when we have people in the audience, we have people in person here. Want to hear your questions as we focus in on what is needed here in Smith County. So I saw some hands up there. Yes, sir.
I'm gonna go back to the first statement that you initially made.
Yes.
If I understood it right, you said that juvenile crime delinquency had dropped 75%
75% of the time.
since the year 2000.
2000, yes.
That seems pretty impressive.
Yes.
So whatever you're doing between now and 2000, be doing it.
The thing is that not many people know that. How many people knew that before I gave you that? Look it up, research, you got all the chat, GPT and all that, things like that. But the thing that happens here is the perception of crime. I'm a criminologist, so I study this every day. It's the perception of crime that has people believe that crime is more significant or happening more, or that you're in it, like you're in it with a family and you see it happening. So therefore the perception is, we've done some great things. Some great things have happened, but if you're still in it and crime is occurring around you, then there is still an issue.
What do you ascribe primarily that tremendous success?
Yes, look at it here. It's what you're doing. If the parent is falling short in what they're doing, or they're not available to be that mentor, that guide that's necessary, then you have to have outside supports to assist you and that child to grow up to what we call social bonding in criminology. The idea of knowing what to do when you're supposed to do it. Doing right because it's right. Look at the social bonding you have in this class right now. You know to raise your hand, you know to listen, you know to sit down. That's someone who has taught you, you've learned by example what to do in this environment. What if someone did not know that? In class, in school, what if someone doesn't know that? What happens to that person?
They get in trouble.
They're known as Bad Johnny. Bad Johnny. Bad Johnny has to make his way to the principal's office. Bad Johnny is then labeled, and just about anything Bad Johnny does after that becomes Bad Johnny. But you won't be Bad Johnny because you know what to do. You step in that gap. If the parents are unable, are not there to do that, you step in that gap, mentor. So we look at mentorship as extremely important, providing examples of what should be done. What's the positive way? That social bonding that we talk about has a lot that has helped to reduce juvenile crime. Now, there's also been programs that have, let's just say, guided people toward a system that assists them to find other ways of making a life, a livelihood. Workforce, for example, workforce connection is very important. Ms. Prince is connected with the workforce folks. What we're doing in criminal justice and juvenile justice is, at one time we thought everybody should go to college. Remember those days, 1980s, 1990s, everybody goes to college. Do you remember those days? Yeah, excuse me, she's trying to show I don't remember those days. Did you see that? Did you see that?
We're too young. How dare you?
But some of you all know what I'm talking about. Everybody goes to college. Here's what we found. It's more important for one to have a skill set and to be able to make a living than to have a piece of paper sitting on a wall. And I'm saying that as a college professor of 20 some odd years. Those skill sets may be that of a plumber, electrician, whatever it may be. So workforce is becoming more important now, where we're saying, yeah, college still exists, but workforce, giving these youth a chance with skill sets. So I know Salvation Army and other programs, Goodwill, they often have quick programs that allow youth to be involved and gain a workforce skill. So that's connections that Ms. Prince will be able to give to you to help you with that. We're going to show our age one more time. Remember the old blue book? Who knows what the old blue book is? What's the old blue book?
Still exists.
Still exists?
I actually wrote all of the smart answers to the quiz.
Blue book, I'm talking about for social services. For social services, maybe United Way in many cities has a blue book, maybe it was called something else, and it had all your resources in it. You would carry that book around with you. If someone had a problem, they need a prom dress, they need this, they need delinquency, and you would use that book. But now we have the computer, we have the internet, those services are still existing, those services are existing. Ms. Prince is making an asset map of the area. Tell us a little bit about asset mapping.
Asset mapping is a new, well, as you described, the blue book is a new way of seeing how things are geographically in your area. And right now, one of the main reasons that we use asset mapping is to see the gaps in services that we have. It is an actual map. It's online, and even and it's through Google. So if you go to Maps, you can create this map of like all the hospitals in the area, or all the daycares, the restaurants, grocery stores. And you can break it up and divide it by, labels with it. If you would like to know more about asset mapping, please contact me because we have, my cohort in Dallas. They have a presentation that they could probably do for you to show you more in-depth, provide more in-depth information about the asset mapping. But it's a very good tool to use, especially if you're working in social services. Because, I get caught, like today, for example, I received a call, believe it or not, that this lady's granddaughter was about to be sentenced in juvenile court. So I had to, provide that information to her to tell her, no, I'm not the right person, but you need to call the Juvenile Attention Center, as we call it here, So it's a very good tool to use, and you can, like I said, break it up into different categories and color code it. But I'm pretty technical savvy, but whether you are or not, just to learn all the benefits of using it and how to use it to help your organization and the people that you serve will be great.
Mhm. Indeed. Oh, okay.
So-
Yes, ma'am.
So
Oh, I'm sorry.
I too, voices.
I know. Oh, I'm sorry. I forgot I was supposed to stay in my window.
Yes, ma'am.
Okay, I was gonna ask, is that something that's customizable to each particular area?
You can create different maps because for the 4 regions that I serve,
Uh-huh,
I have a map for each one.
okay, so it's a big map and then we can pinpoint the areas, like he was talking about Wood
Right.
County, Smith County, Mandes County are the 3 counties that we.
Right, and what I have, the way I did it right now, I have one for Northeast, then I'm responsible for Southeast. So I have a different map for that one, but I'm sure there's a way you can overlay. I have to get into it, because this is new to me too, but to see if I can do overlays and see, Smith County has 10 hospitals versus in Houston, there's 50,
Yeah.
I'm sure there may be a way, but I have to figure that part out. So,
Okay.
Yes,
Thank you.
Mhm.
yes. Are there any more questions?
Yes, ma'am.
Yeah.
Yes.
Oh, somebody
Should we go
else.
online first?
I'm trying to have them online submit,
Okay.
written out.
All right.
Okay.
Yes, ma'am.
The Salvation Army and Goodwill, I wasn't understanding what you were saying
Sure.
about those organizations and how they help with trade schools or
Sure,
whatever.
indeed. At least in Houston, I know, and I'm sure Ms. Prince can tell us here in this area, they'll build programs for you so that your young folks, your students, your youth can go through short programs, something like welding or another thing like that, and have the skill sets to be successful in the future out there in the community. So I'm sure Ms. Prince can see if that exists here.
And I do have an answer for that question.
Yes, excellent.
Goodwill does have a program, I believe it's for the summer, through the Goodwill off of the Loop.
Okay.
And then they also have programs for ex-offenders, and some more, work programs there. They've changed the name of the person that there recently, so I'm sorry, I'm terrible with names,
And
but
you don't know about Wood County on that.
but you know what, they probably could refer you to somebody. A lot of these places around here, they cover multiple counties. So, and I believe those programs here cover multiple counties. So if you ask for, and email me and I'll get you the lady's name. It's slipping my mind right now. Yes.
I'm looking at your emotional wellness and a self-esteem and a self-coping. Are you guys going into foster homes and providing these services to them, or are they coming to you guys?
We go inside.
Okay.
So we go inside juvenile detention centers, we go inside schools in the districts, we go inside foster homes, Salvation Army, wherever the need is needed, where we're going inside. We rarely bring students on campus. I bring them on campus for other reasons, like for different conferences and summits and stuff. But it gotta be based around something. But when we're providing a service, we're out in the community. Yeah. Sure.
I just wanted to add on, circling back to the Goodwill, what they have to offer. I just visited with a gentleman last Thursday at an event. And they offer all kinds of computer training. They have to be at least 18 years old. And some of it is online, some of it I believe is in person. But they have a class that's starting sometime in May and then another one in June. Is that correct? Yeah, in June. And I think there's 16-week-long programs that they have, but they can give them different types of certifications that will really make them very marketable, their skills very marketable.
Yeah, and it's from when I visited a couple of years ago, I mean, like you said, they have more than what I'm telling you now, so, and I'm sure more has been added on, so I will get you that number, so that you can, call her. I'm trying to remember her name, but anyway, but yeah.
I think there's a gentleman that's in charge of it.
Oh, see, that's what I'm saying.
And actually,
So,
I have his card, so if you just give me a call, okay, I can give that and I can forward it to you as
see,
well.
that's what we're all about, is connecting people to the resources that they need in this community. You know, and talking to my cohorts, we felt there was a need to explain to people like you what we exactly do, because everybody's like, what is that? You know, and I have to explain it, but allowing us to do presentations like this enhances your knowledge of the community. So if at any time you would like us to do a presentation at your organization, your church, or anywhere, please don't hesitate. And I can see, you know, if we can make that possible to present to you and other people and make arrangements for that, because you can definitely use my office. I have a suite. And if you want to come visit me, please do, so I can, you know, show everybody, and to you online too. I really want to get out and invite people there, because we want to provide a database of, you know, all the community services that we have, you know, and I'm finding out more as I go out in the community and talking to people more about things from from 1 month to, you know, to 2021, you know, especially with the programs like the TWC WOIA program, which is a good program. They do offer things for children who have aged out of the foster care system, and that includes apprenticeships. As a lot of them, they can either pay that company to pay the person, or, you know, pay straight from their organization to pay that person to work. So that's something to consider. Yeah.
Do we have any questions online?
I think that you answered it. One was just clarifying, are services trainings provided to children who are in care or only to the adults who work with them? If y'all are able to elaborate on that at all.
My training specialist.
Just clarifying, are services and trainings provided to children who are in care or only to the adults working with them?
Okay, so we're talking about foster care, or are we talking incarceration?
Foster care.
Foster care, okay. Yeah, we can do programming for everyone. You know, we don't want to put any limit. Like, if your community expresses a need, this is what we're looking for. We want the kids that are in care. We want to get them trained on something. We also want to educate the parent, because there's always reunification. And so we want to prepare the child and the family for that reunification. So if there's something that you see as a need, we'll design something for you and then we'll deliver it. And it could be in person, it could be on Zoom, it could be any way. And I understand that, you know, we're looking at people who are at school or at work all day. We would do something in the evening to make life easier, and just try to kind of really gather as many people as we can, so we can increase everyone's knowledge, so that that young person is safe and the parent is safe. And then as they go through that reunification, they'll stay together, because we know that when a child is removed from their home, it's very traumatic. It's a life-changing event that can increase those adverse childhood experiences. And so we want to try to see if we can manage that with skills and knowledge and education.
Yeah. Thank you.
And I would like to add, I do have her, what do you call it, curriculum?
My catalog, my course catalog.
Her course catalog.
Yeah.
I do have access, and I can email it to y'all. Just send me a request
whatever you want to request from me. Just send me an email or call me,
Yeah.
and I will try my best to get that to you in a timely manner.
And just know that we're building things, so that's why we need your input. We can't tell you what you need, but you can tell us what you need.
Unfortunately, our website is under construction.
Yes.
So if you go to the website, you'll see, what are these people talking about? They're saying all that, but their website doesn't say that. It's under construction. That's why your main point of contact is Ms. Prince. And I thank you
Yes.
for handing out the card so that you know exactly how to get in contact with her. We have a mandate. Your tax dollars, every time you go to the gas station, yes, we don't pay taxes per se in the state of Texas, but your tax dollars go to help us to do this job. Put us to work. Put us to work for the welfare of the youth of this county and of the state. So that is what we want to do.
That kind of leads into the next question that was posted. So through our advocacy, we have kids that are scattered all over the state. How might y'all be able to help?
I'll take that because it's a statewide question. There are certain counties we're focused on now, but we have a mandate to move throughout the state. So if you could bring that to the attention of Ms. Prince or myself, that tells us where the need is. Where the call squeaky wheel gets the oil, or squeaky gets the oil. Same principle. If we hear that there's a need, then we may be able to go there and solve some of the issues, or at least work on it.
And if I may, jump in really quickly.
Please.
Hi, Dr. Joclyn Mandes. Sorry, I'm still getting used to the fancy title. What you just said was really interesting to me, right? I have been looking at the research on this very specific challenges that foster children have to deal with. And so you're bringing up the fact that, you know, a lot of the children that you serve can be placed so far away from, you know, their birth home. That is a challenge that we see reflected in the literature, where instability is directly associated with increased likelihood of, you know, delinquency and just negative outcomes in general. So from a research standpoint, we try to base our trainings and our programming in not just opinion, we try to triangulate that with data from multiple sources, right? So law enforcement data, data from potentially from CASA, to make sure that we are establishing a full, complete, and accurate picture of what's actually happening in the communities across the state, instead of just assuming that they're all the same, if that makes sense. And so, you know, there could be a possibility for a research project in your question. How are those placements impacting the children that you're serving? And through the research, we can look at coming up with an idea for how we might help you. So that's kind of how the flow of information works in our center.
Okay, thank you.
That had me think of while I was driving up here from Houston. You all know Houston, of course. Prairie View. Anybody been on Prairie View's campus? Oh, yeah, sure. But driving here, the road brings me to the Crockett State School. Anybody familiar with the Crockett State School?
Yes.
That is one of the Texas, well, it used to be TYC, Texas Juvenile Justice Department schools that is closed now. And so I stopped there. The old buildings are there where the youth used to be. And I just stopped and I'm going to say it, and I prayed. I did. Because I thought about the many thousands of lives that have worked their way through the Crockett State School. It's closed now. TYC, the old TYC, is now down to about 6 centers around the state. It used to be around 25. Now they're down to 6. Director Carter leads the Texas Juvenile Justice Department. They have seen their numbers go down. But remember, those that go to TJJD are your most serious offenders that have not been certified as an adult. So about an hour away from our campus, Prairie View, is the Giddings State School. That is where the most serious offenders that have not been certified as an adult, that is where, until they receive 17, 18, 19 years of age, when they have aged out of the system, that is where they go. All right, so there's a lot going on here, but Ms. Prince is your main person, your main contact person. I just want to ask if we have just a few more minutes here. What do you need? What are you seeing that you need here in Smith County? What's lacking in Smith County that we need to be knowing of and have knowledge of? What's needed here in Smith County to reduce delinquency? As he looks around and says, "Oh, someone else can answer. You probably have a good answer, sir."
Well, I'm in Wood County, so.
Wood, okay, and how far is Wood from where we are right now?
About 45 minutes,
Yeah,
an hour
45
north.
minutes.
I think maybe parenting classes.
Mhm.
That's my thing. I love parenting.
Continue to.
Yes. And then, thank you for saying. I'm a former juvenile probation officer. So the kids, some of the kids that you have are the kids that I had. I had kids that were both in both systems. And I'll say every one of those kids' parents needed parenting classes. And not because they were bad parents, but because they wanted to be good parents, but they didn't know how to do it. And they were afraid to admit to us and the courts and everyone that's involved that I don't know what I'm doing, but they didn't realize that it's okay not to know what you're doing. And so we have done parenting classes in the past. I'm hoping to bring them back. We're again collaborating with the Annie E. Casey Foundation, who has quite a bit of classes. And one of the classes is Teen Connect. And we're hoping to get my colleague, Joclyn here to become a facilitator. I'm already a trained facilitator. And that parenting course is a 10-week course, and it reconnects that young person with their parents. It teaches them different skills and sort of other ways of solving problems instead of the other way, screaming and yelling, arguing, fighting over little minor things. It teaches them how to let some of those personal things go and stay focused on the goal, the relationship. So that when you're talking to me, I can advise you as a parent and keep you safe. And so that you're not getting bad advice from peers that are then going to increase the probability of you going to jail or prison or detention or whatever it may be. So this is a 10-week course, and it's just once a week, and it's generally in the evenings. It's an hour and a half, and we teach them 9 different principles, and they come out of it just looking at parenting from a very different angle, because we bring the information that we have from our childhood and everything to this moment. And we've learned bad parenting from our parents, not because they intended, but because it was an old school way of doing things. This is how we raise kids. Where I grew up, you are seen and not heard. And if you speak out of line, you roll your eyes, you're disrespectful. And so, yeah, I can see where that might come across that way, but is that what's important? I think we need to be more afraid of, is my child out there? Is he going to go and experiment with heroin or opiates? Or what is in that vape? Or will my young daughter end up pregnant or end up trafficked? So there's bigger concerns, so that we'll train you on, let's not focus on the little stuff. Let's focus on another way so I can get you to talk to me and trust me, and then we can keep you safer. So that's a parenting classes we want to roll out. Hopefully by summer. We'll see. Hopefully by summer, because again, she has to be trained. This is the Annie E. Casey Foundation. They've got rules. We've got to follow those rules. It's a curriculum. It is evidence-based.
Yes.
But once we get that going, trust me, the results were incredible. The parents loved it. We did that I think I was up to about 8 or 9 counties.
Mhm.
We were doing them over Zoom, but we'd like to do them in person too. So, but yes, I knew it. Parenting classes are a
Yeah,
big
it would
thing.
be nice to do it where it's not court mandated.
I understand. No, I agree.
We can catch it before.
Yeah.
The judge is saying you have.
But
Would you get the attendance stuff? Tuesday night, would you get the folks here if it was not court mandated?
No, that's the other thing.
Yeah, so.
that's what we think about and talk about possible incentives.
Mhm.
We believe that sometimes you got to give that little carrot. And then what happens is once you get in the class, the information that I tell you, I just do 2 sessions, they're hooked. And there's some of them are sad that it's over because it's that good.
Mhm.
And so that it's just getting you in there. And once we start talking to you, you're going to start seeing, oh my gosh, I'm glad I'm here. And they were all court mandated and they loved it. They came in kicking and screaming, I don't want to do it.
Would love to have something like that.
Yeah, right. So, yeah, but even the parents that were the most resistant, I'm talking to them on the phone, I don't need this. This is a load of crap. The judge is making me, he's the one in trouble. And then I started to offer the other idea, like, I understand you may not need it, but I would really love it if you were there. I would really love to hear your opinion on what's going on with you. It doesn't have to always be about your kid. How do you feel about what's happening? It really changes the angle in which other parenting classes I have seen and heard of, this is a very different approach. We're not going to tell you you're a bad parent. We're going to tell you you're a good parent who loves your kids, but you want to reconnect on another level. Make sense? All right, no
So
problem.
parenting class, what else do we have?
One that comes to mind for me is after school options for older youth.
That came up yesterday. Talk to me about that.
That one is a big thing right now because, as you all know, in Tyler, they have a lot of millions of programs for 12 and under, pretty much. But when they hit that middle school age to high school, there's little things that, little possibilities or opportunities that we have around it. That's one thing that we're working on, developing with our program department. Because after we get the research from this last study, the Texas Child and Family Study, that came up, and an overwhelming amount, about 90% on average, these kids answered, yes, we need a reading program. Yes, we need more people to talk to other than our parents. Yes, we need ways to earn money. So that's another thing that we're going to be working on now, because if you do the research, get the evidence, then if you need training or programming. What we can do for the community is either create a program through our center, or we can analyze an existing program and then report back on our findings. And when I say analyze, not to just ding you for what you're not doing, but to analyze how effective this particular program is, or if it needs improvements, or you're doing an awesome, amazing job. Keep doing what you're doing, because we want to have that impact on the community. You know, we just don't want to be doing anything just to say, oh, I got $1 million for my organization. Well, is it meeting your goals, your mission, your purpose at the end of the day? So that's another thing that we can do. We offer, through this center. So yes, ma'am.
I think it would be really cool too to have because I think that kids don't know what kind of trade opportunities are out there. And to have a way to introduce, our grandson's a welder, and he just happened to have a class that they introduced it at school, and he's like, wow, I love this, I'm really good at it. And now he's doing great. But that was just lucky that he took that class.
Right.
And I think we don't, how can we get this information to the kids?
An example is in Houston, we had an event called Tool Fest with a partner of ours. Tell them a little bit about Tool Fest.
Yeah, so NEKC Foundation collaborated with this group, and they put on something called Tool Fest in Houston. And what they did is they introduced young people to all the possible trades. And so, because like you were mentioning, some of us, we want to go to college, we want to get these degrees, but some of us really just are more experiential learners. And so that's what these trades do. But yeah, they had a variety of different schools that came in, some homeschooled kids too. And they just went through all the workstations, and they were explaining to them the different possible trades that you can then, in a short period of time, maybe 18 months, end up with a certification and really be making a lot of money, And so, but yeah, that's something that they're already working on. They're recognizing that we don't want to lose that group. Great, we're going to always do college and offer this out, and there's plenty of money for that. But what about that other kid that's like, where do I belong? What is my future? And so, yeah, they did put that on. It was really well received. But we know there's more work to be done, and they know that too. So
yeah. And I would just like to mention my high school band director, what I was telling us, he would point at us, not all y'all going to college. And we were gassed. Like, what? But growing up, he would tell us, she knows Mr. Samples, but in growing up and, seeing what he was talking about, because he would always tell y'all need to learn a trade. We need bricklayers, we need plumbers, we need electricians, welders. And so in growing up and being more involved in the community, I found that to be true. So I'm glad you addressed that problem, because that's something that we're working on right now. And I'm gonna put my shameless plug in. We're planning a summer youth activity fair.
There you go.
Here. So if you would like to be on this planning committee, because I can not do it all.
Yes, you can. Yes, you can. He just.
I'm gonna need some help.
There you go.
I know when to ask for it. So please let me know that if you're interested in planning this, because we're gonna need organizations like, here here to tell you what you can offer families or, you know, like they were saying, that's the Tool Fest.
Tool Fest.
That is so neat. But something like the Tool Fest, we have, you know, vendors there. You know, booths, so they can tell people, hey, your kid is 16. You can get an apprenticeship with this plum over here, you know, or something like that. So that's what, this is not a novel idea. They did it years ago with, I don't know if you ever got to attend one with TISD. So I was like, you know, we haven't had that in a while. So things like that to get the information out. And then if you know somebody with kids or that are, you know, working with kids, let them know, hey, we have this center here, or, okay, McDonald's has a summer intern program to be a manager, you know, if you find out, but, or get them on to the WOIA program with TWC. Well, so sorry, Texas Workforce Solutions, sorry, not TWC. But, you know, we just have to recruit and get that knowledge out there to people. As they say, a closed mouth doesn't get fed. So if you're not telling people or disseminating information about services, then it's not going to get out. Yes, ma'am.
I do have something to
I'm
add. Sorry, one more second. I do have something to add and I forgot, but while I'm thinking about it, we talked about Annie E. Casey, they're already here. The family they're conducting a whole programming in Tyler already. So we can try to see if we can coordinate with them and let's get a Tool Fest here. I think it'd be great. Yeah, so maybe we can do something. I'll be in contact with our contact with Annie E. Casey, and then we'll see if we can do it. It was really neat. Like they even had one room that only the older kids could go, but they had drills and one of them was like I don't know what was it? They had like
The art of the painting.
the goggles and they were and they were painting and it was just cool. And so the kids were lined up. They were so excited. But I think that since they're here already, we're gonna go ahead and see if we can set something like that up.
Yes. And
Foundation that you're saying?
the Annie E. Casey Foundation.
NEAK.
Annie E. Casey. Yeah, they are, yeah,
Oh, Annie E. Casey.
yeah, they are a,
CASEY.
yeah, they are a global entity that really provides tremendous services for young people and families, really making a global impact on lives.
Yeah.
And so, but they're here in Tyler. So with that study and other things they're gonna do, well, I think we can add a little more.
Right. Yeah. And so I have one more thing to say. With the Career and Technology Center, they offer a lot of different trades. Everything from being a school teacher, they got an education department, they have digital media, welding, of course, automotive. I don't know if they have the beauty services anymore. And you can go in and get your hair, nails, whatever fits at a discounted rate with them, but and I get you the name of the lady, the counselor there, because I believe with that school, you have to apply for it, you know, and then you can get in and choose your career path, and they have a number of certificates that children can get by going to the school and going to the classes before they graduate high school. So
What's that called again?
the Career and Technology Center,
Is that, oh no, what's?
Earl Hamel.
Yeah.
Yeah, right.
It's by Heaton Eye.
Yes,
Yeah.
yes, by Heaton is the next building over, and then there's an early college school right next to it, and of course the pool. But yeah, they're all over there. I'm sorry, Lucy.
That's okay. You mentioned TISD, and I wondered if you had, have you done any partnering with them? Are they receptive to partnering with what you want to do?
You know what, they have been, they're a big part of why I'm still existing. Because we worked a lot with TISD on the studies that we conducted. They were very amenable to us coming in and doing things. Of course, we had to get approval for each one, but yes, TISD has been a tremendous factor in our success with different programs and stuff. So we are still continuing to work with them, because I work mainly with the deputy superintendent, Mr. Jones, on different things, and then the relationships I have with schools here has been a very big help. Yes, we do.
And so the name of the initiative is the Texas Family Wellbeing Initiative. So they're already here, and I think we can make contact with them and see what we can coordinate and start doing some more.
All right, so we've got 3 ideas. Let's go over like in class. What were ideas that came from the audience? Parenting class,
After school program.
after school programming, trade school development opportunities beyond college or other than college. And 10, you heard Ms. Prince says, we're gonna work on having some sort of tool fest or activity taking place. Indeed, anything else that you can think of right now. This is a type of research. We call this kind of like a focus group. Don't say anything. You're supposed to go to an IRB and everything. But this is us getting your point of view on some things. Anything else? I think that's 3 or 4 for us to work with right there. That gives us a lot of piece of information there to tie together there. So I'm going to sit down. It's 1 o'clock. You said we have until 1:15. Any other questions that you have for the team that's here? We go back to Prairie View, to Houston. She's here. She's your person here. You have her card. She's the one that you talk to. Okay.
Yes.
I'm going to sit down. Excuse me.
It'd be nice to have a list of programs designed specifically for schools.
That's what I've been working on, and every time I look at that list, I'm adding I'm adding more to it because I'm over Smith County, so, well, one of the counties that I'm getting information from, but I have to go back over it before I send it out to make sure these programs are still existing.
We're changing up.
Yes, but honestly, you have like your Mentoring Alliance and, trying to think of another one. Oh, Christie Safe Haven is another one that's kind of new. And she's having a lunch and learn actually tomorrow. I can forward y'all, just email me and I can get that to you. But she's having a lunch and learn about all the services that she has for youth. And I've had family members that go through one of her programs.
Is that with the Smith County Clubhouse?
No,
Okay.
that's you're the 4th person that's mentioned it. Actually, did you get the invite? Okay, I'm sorry.
No, that's okay.
But she's having something.
Yeah, okay. I didn't know if it was.
I know, no, they're not the same one. I gotta figure out what the clubhouse is, because everybody's like, what is the clubhouse?
It is it not disabled, but mentally challenged adults, I believe.
Oh, okay, because I've read it something for adults, but you know. But what's
So
up?
many awesome places, Christie's Safe Haven.
Yeah, Christie's Safe Haven. And she's on Front Street now. She was over there by the old Sweet Sue's. But now she has an event center on one side, look like, in the Christie's Safe Haven on the other one. But she, I know what I was saying. I have had family members to go to some of her classes that she offers. Now, she does travel. And I believe she can come to Wood County, but I'll get you the information so that you can, contact her or come to her lunch and learn on tomorrow, and she will feed you. It's from 12 to 1, or you can come 1 to 2 tomorrow. It's right off of Front Street. But I don't have the address on hand, but it's a Good Time Event Center. If you look that up, that's
I
where.
think I have that flyer and I can.
Oh, yeah.
I can email it out to everybody that was here today.
All right, thank you, Linda. I appreciate that. Yes.
Do you have any programs to help children get their GED?
I don't, but I know the Literacy Council here does. I'm trying to think off the top of my head. I know they do. But I don't know about for youth, but I'm sure they do. They even have bilingual GED classes too. So they would be a good place to start. The East Texas Literacy. Why is it? I have EdSil in my mind, but you know what? They changed their name.
It's
But look up what.
paved pathway.
Yeah, I knew it was something they changed it to. Say that again so everybody can hear.
Paved.
Pave?
Paved.
Like pavement,
P-A-V-E.
pave.
Oh, PAVE. Look up the PAVE program, PAVE. Thank you.
Yes. May I just ask, are you asking about like preparations, like helping children, like, like youth, study and prepare for the GED exam?
Yes, we have a lot of teams, that get placed multiple times. So they,
and they're not going to school, and when they have the opportunity to take the Excel program, they still want to be part of the school, some of them. Some of them like doing the Excel program, but they give up.
Yep.
Yes.
Because they're so far behind.
Yeah.
And, yeah, they just give up and don't want to do it.
Oh, I see what you're saying now.
And then
Yeah.
then it's very difficult for them to go through the GED program.
Mm-hmm.
So, right.
Well, because schools aren't synced in terms of when they present different topics and help develop kids, help kids develop certain skills, right? So if you're moving from school to school to school, you could be studying one thing 3 times rather than getting the full education that you need. And so it's sort of like disadvantage built into being in the foster care system. So maybe an online program would be helpful, something that they could access on demand whenever they were available, that kind of covers the full range of topics that are on the GED. Okay, just getting ideas.
Yeah.
Thank
And
you.
a lot of them
And
don't have the funds to get laptops. They're trying to do the program on their phone, and that just doesn't work.
right.
Okay.
And another school, I'm sorry, I misunderstood what you were saying, but another school within the TISD is you know where the old Stewart Middle School is on it's look up Title I services, because they have a school for high schoolers within that building that actually helps children that are having problems at home or not up to speed, to get them to graduate. And the kids love this program. They even have a principal that buys hygiene items for these children that need it. So that would be a good resource. But I tell you who to call. I can't think of the name of the actual program, but it's Gloria Bell. And it's like a bell you ring. And tell her Yolanda sent you. And then another thing is Premier High School is another good resource for children who, they want to go to school, they want to succeed, but they're just not able to handle being in, a normal school setting. So it's at a slower pace, and it's more one-on-one with a lot of children. And that one is off of Glenwood, right by Fun Forest Park. Yeah.
And then we have a lot of kids that are placed in the Houston area.
Have a lot of what?
Children placed in the Houston area because we don't have enough placements here for the children.
Oh, I know. I know. And I'm looking more into the foster care program myself, because I do want to understand. And I've talked to so many people that have gone through the program or need help for people in the programs. So, and I found, I don't know if y'all know Dr. Shirley McKellar. She's a good resource to help with the foster care system. And Sharonica Holmes, I don't know if you know her, but she's another good resource. She even has a group home for people that have placed out on the foster care systems, because she was a foster care kid herself. So she's very passionate about what she does for foster care.
Yeah, we definitely need more, not only foster placement, but like RTCs or group home in our area.
And Sharonica would be a really good person, and also Dr. Shirley McKellar too.
Okay.
About that. And then if they're filled up, then I'm sure, they could get that. So, but I do want to commend y'all all for what you do, because it's not hard. And I have a big heart for children and their services that are needed for them. Having at one time worked in educational settings, I saw a lot. But remember, with our center, everybody is a master at some things, not all things. Like you have Rebecca over here, a training specialist, who she's worked in the juvenile court system. I worked in education. We have somebody that's worked in social work and other things, within our center. They have experience in, and we all bring it. We all bring that knowledge and that wealth, because I'm too soft for it to be a juvenile probationer. I would be like, no, you just, oh, no. No, we're gonna give you 2 days, but no. But, working with people like that and all the knowledge that they have, and then even Dr. P and our great director has a lot of knowledge in juvenile justice. And that helps a lot, with everything and allowing us to do presentations like this to inform the community about the things that we do. That means a lot to me and to the center. Because we do our goal is to really go statewide with the 254 counties that we have in Texas. So, are there any more questions, comments, or concerns about anything that we do, or?